Currently in Dallas, there is not a place for homeless persons to recover following an acute illness. When they are not sick enough to be in a hospital, but are too sick to be in a shelter, they are left in a difficult situation with nowhere to go. We will present a plan that eliminates this gap by ensuring that everyone has a chance to heal and a community to recover in. We worked with Union Gospel Mission, a faith-based homeless men's shelter in Dallas, Texas. Union Gospel Mission, or UGM, houses 300 men every night. While most of the community is transient, UGM also has a program called the Disciple Program that allows around 150 men to stay at the shelter day and night for about 12 to 18 months while they receive resources to help them find jobs and get back on their feet.
In order to make sure our plan was unique and tailored to the needs of the shelter, we spoke to residents, leadership, and clinic staff at UGM. The specific charge we were given was to reduce readmission rates and death amongst the homeless population at UGM by 35% within 1 month of hospital discharge. Our plan is a 3-step approach consisting of the creation of a community health worker program, a collaborative tech-based health coaching initiative to address chronic issues, and finally, a freestanding medical respite center to address acute issues. Each section is going to be structured around key issues they address, our recommendations, costs, and funding sources.
Our first recommendation is a community health worker program. There is currently a gap between the community and the healthcare system, and in order to ensure a high-quality level of care, we need to bridge this gap. To do this, we will utilize community health workers, or CHWs. Community health workers help to build the necessary trust between providers and patients through their strong sense of cultural competence. We recommend that UGM assign CHWs as logistical supporters or community advocates. Logistical supporters will be in charge of things like scheduling and paperwork. Community advocates will act as health coaches for their clients. Moreover, they will also engage in weekly meetings with their supervisors to evaluate the status of their clients. Our solution involves integrating the discipleship program into our CHW plan. In order to integrate healthcare workers who truly understand the experience of homelessness into our respite care center, we are proposing that 5 to 20 interested disciples undergo training to become certified CHWs. In order to train the community health workers, we would use the Faith Community Nursing and Health Promotion Program at Texas Health Resources. Additionally, training could be provided by 5 other community health worker training programs in Dallas. These community health worker training programs cost as little as $600 per person. After that, certification is completely free. The Texas Health Resources faith-based health promotion is also free, and the return on investment of these programs will be significant, because evidence shows that the healthcare systems that use community health workers can save as much as $5 for every dollar invested into training. 2 funding options for the program include 1. Sponsorship from work grants and private donations, and 2. Hospital contributions. By combining these 2 resources, the program will cost UGM nothing.
The second piece of our proposal is a technology-integrated health coaching program to help individuals experiencing homelessness build a healthy future. This program would be called Union Gospel Mission Community Health Assistance Technology, or UGM Chat. The program aims to use persuasive technology to promote healthy and positive lifestyle habits while providing individuals with an advocate and accountability buddy. A similar program has proven to reduce depression among clients by 33%, and there was a 36% reduction in the number of substance abuse users. This will be implemented using community health workers from the discipleship program in the Dallas area who will serve as health coaches. The coaches would serve in 2 primary roles, the first being in-person health coaching, where 1 time a month, clients and coaches would meet in the computer lab for goal setting, motivation, and solution-focused planning. The second part would be text reminders filled with tailored feedback. The outcomes of this program would address chronic health issues and thus reduce hospital readmission rates. Similar programs we've researched cost $750,000. Because our model is comparable, this is also our estimated cost. The money will go towards staffing, software development, management, and incentive components. Fortunately, this program can be covered through 2 sources. The primary funding is the Medicaid waiver 1115, It's an innovation grant designed to meet the health needs of low-income and vulnerable populations. It should be able to fully cover the cost of implementing the UGM chat program. Additional funding could be provided by multiple medical facilities.
The final piece to our solution is a medical respite facility. Currently, Parkland delivers about $871 million in uncompensated care a year. Additionally, homeless men and women are high utilizers of emergency rooms due to their perpetual cycle of illness and treatment. Parkland has recently tracked over 100 high utilizers who have used the emergency room at least 10 times within 1 month alone. At that rate in a year, over $44 million is being used on those high utilizers. Medical respite is a recuperative care for persons who are too ill to recover from a physical illness or injury on the streets, but are not ill enough to be in a hospital. Medical respite centers provide hospitals with a safe and legal discharge option for homeless patients and create a continuum of care between hospital and supportive housing programs. Based on the size of a similar facility in Houston, we have found several building options. We estimate renovations needed to make a functional respite center from one of these proposed buildings will cost about $1,200,000. Additionally, there will be estimated yearly costs at $530,000. A top priority for both Parkland Hospital and Baylor Scott & White Hospital is increasing access of care for low-income residents. Additionally, North Dallas Shared Ministries is a coalition of local churches that provides nearly $3 million annually. In addition to this, government grants are already lined up to provide for many of the costs. By combining these and other resources, we believe that we can fully fund the program.
Because of our incorporation of 3 programs with proven success, our plan will reduce hospital readmission rates by more than 50% and will create a healthcare experience that is more patient-centered, that is rooted in compassion, and that is rooted in understanding for people who are part of a largely underserved and underrecognized community. We hope that through our plan, we can give everyone a chance to heal and give everyone a community to recover in.